Intravenous Flush and Visual Infusion Phlebitis (VIP) assessment is a skill station newly added to the Nmc Osce in 2022. This could be one of the 4 skill stations you can expect on the day of the Osce examination. This skill station is performed as follows. You will perform this station on a mannequin hand and you will be provided with a picture card of the IV with some symptoms. The allowed time for the station is 12 minutes. This station can be classified into 3 phases, which are: Introduction phase, Procedural phase, Post-procedural phase. Introduction phase. In the introduction phase of the intravenous flush and visual inflammation of phlebitis score assessment, you will need to perform all of the listed below. The mentioned below are almost the same for each skill station in Osce, however, prioritize as needed. Checking for scene safety. Close the curtain or door to ensure privacy. Hand hygiene. Introducing yourself to the patient by saying your name and adding that you are going to look after them today. Confirm the patient's identity. Ask for their name, date of birth and hospital number, but you can also confirm this by checking against their wristband. It is mandatory to know about the patient's allergy in the introduction phase. Explain the procedure to the patient and gain consent. Ensure privacy and dignity throughout the procedure. Procedural phase. Hand hygiene before assessing the cannula. Assess the site carefully and watch for any signs of phlebitis such as redness, pain, inflammation, venous cord and fever. Use the following assessment tool to assess visual inspection of phlebitis score. Hand hygiene after touching the patient. Confirm whether the equipment is clean and ready to use. Clean if needed. Assemble equipment after confirming expiry and check whether the packages are intact. Prescription and patient ID check. Return to the patient and check the prescription. Check whether the prescription is valid by confirming right drug, right medication, right time, right route, and right dose. Essentially, also check the patient's ID, allergy, doctor's name, signature and registration number, validity and legibility of the prescription. Hand hygiene and PPE. Clean the cannulation port with alcohol wipes for 30 seconds and allow it to dry for another 30 seconds. Connect the loaded syringe to the cannula port using ANTT without touching key sites and key parts. Flush the cannula in a pulsating action. Ensure that the patient is not experiencing pain when you do this. Post-procedural phase. Waste disposal and cleaning, discarding the waste appropriately following the waste management policy. Cleaning the equipment used using the clinal wipes. Remove PPEs and clean hands with hand rub or soap and water as required. Documentation. Document the findings and administration record. Check date, name, signature and sign. Reassurance. Ensure that the patient is comfortable and check whether the call bell is in reach before you leave the patient.
For more videos of Osce, follow nursefacts.com.